Good afternoon. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to today's special news conference with the COVID-19 vaccine in the Amarillo community. I'm going to go and turn over very quickly to Mayor Nelson, and then we'll take questions from media members in attendance. We'll go ahead and turn over to Mayor Nelson at this time. Mayor, how are you?
I'm well, Dave. Thank you all for joining us today. It's really important to us. I know a lot of citizens have questions about the vaccine arrival in our city, who it will be given to first, when it will be available to the city as a whole. So obviously the information that we have is coming from the state, and it could change. It is changing really hour by hour. So this could be different information this afternoon, but we think it's important to get you the information just as soon as we have it, and we're relying on you to help us get it to citizens. So what we know is that the vaccine will be coming to Amarillo tomorrow. The state notified us that the first shipment of 975 doses of the Pfizer BioNTech COVID-19 vaccine will be deployed to Texas Tech University Health Sciences Center, and that is scheduled to arrive here tomorrow. That would be Tuesday, December 15th. It will be stored in the Jerry H. Hodge School of Pharmacy. That has the freezers that are specially equipped to hold the vaccine at the proper temperatures, but it will be split evenly between BSA and Northwest Texas Hospital. Texas Tech's going to coordinate with our hospitals in order to ensure that the immunizations are made available first to the first tier hospital staff, who's working directly with patients that are positive or at high risk for COVID-19. So we expect that vaccine to arrive tomorrow. That could change, but that's the information as we know it. This process is fluid, and we know that the state health department and federal partners are working hard to roll those vaccines out across the nation, and we're just part of that process. So I appreciate the work that the state's been doing, and as the information changes, we will obviously communicate that to you. How many doses of the vaccine is Amarillo receiving? This batch of doses, this first batch we're getting is 975. And that is part of the pre-positioned vaccine that was actually sent to the state of Texas. I think they received 1.4 million doses before it was even approved by the FDA for use. So they had that pre-deployed or pre-positioned vaccination batch, and we'll be getting 975 doses out of the pre-positioned part of the vaccine that arrived at the state of Texas. We expect to get more allocations. Those could come really at any time. We don't have exact timing on that. The state has visibility on that, and as soon as they give it to us, then we can give it to you. Who will get it first will be those hospital workers on the front lines taking care of COVID patients. I've had some questions about, will the vaccine be mandatory? It is not mandatory for citizens to get the vaccine, and there's no plans for it to be mandatory or required at all. As a matter of fact, this vaccine cannot be mandatory because it's approved under an emergency use authorization through the FDA. So just again, the state has done a good job in this challenging situation of getting us the information that they have. And as they have more information, we'll get it to you. But I just want to emphasize that we're getting this to you as we know it now. It could change, and it could change even as quickly as this afternoon. So we all understand this is a very fluid situation, and we're getting you the information just as soon as we are getting it from the state. I think that's all I have, Dave. Do we want to do questions?
Yes, let's go ahead and open up the questions to the media. We'll start with David Furtado, KVI Channel 7. David, how are you?
I'm doing pretty good. How about you guys yourselves?
Good, thank you.
Good. So I just kind of had one question. Obviously, we're going to see the first dose starting tomorrow, but how soon, obviously, My question really is how long would it take? Because are all the shipments going straight to like Austin and then moving out, or are they all coming directly to those specific areas? Like it came right from Pfizer right to us here in Amarillo. And yeah, that's my lead question. I don't really have much else after that.
When I asked that question to the Department of Health and when they called to let me know about the vaccine coming, they didn't even know. He did not know if it was coming by private carrier. He didn't know what, where it was coming from. So I think it could be yes, and they don't know yet. As far as this pre-positioned vaccine, I don't know, but might assume that it was all housed currently in Austin, but vaccine going forward might be direct shipped to different parts of the state. So again, your question really just reveals how fluid this situation is. And that information is, as it's happening, becoming available to us from the state.
All right, super. Thank you so much, guys. Appreciate it.
Thank you, David. Let's now go to David Gay of Amarillo Globe News. David, how are you?
I'm good. Good afternoon, everybody. I guess my question, I'm looking on the DSHS website right now, and they have a document on their website called COVID vaccine allocation week 1. And it says the 975 doses to Texas Tech on here, but it also says an additional 975 doses to the Northwest Texas Hospital Pharmacy, the pharmacy. Do you guys know anything about that allocation?
Expect that allocation to be coming out in the next tier of allocations of the vaccine. We mentioned this Texas Tech portion, or the 975 that's arriving at Texas Tech, hopefully tomorrow, is part of the pre-positioned allocation or distribution of the vaccine. So what's coming to Northwest, hopefully by the end of the week, is what is in the first round of vaccine, not out of the pre-positioned part that was distributed before it passed FDA approval, but what's being distributed after or since the FDA approved this end of last week. So just a quick answer to your question, David, of when, I don't know for sure. The state hasn't informed us of that.
Sure, absolutely. And I'm curious, do you know the process of when the vaccine arrives tomorrow? What's the process after that? Will it have to be stored before given to people? When are we going to expect the first individuals to be given this vaccine here in the Texas Panhandle?
Yes, obviously this vaccine does have some very strict storage and distribution. Like you can't just pop it out of the storage and give the shot. There are strict protocols that need to be followed in order for the effectiveness of the vaccine to be as high as possible. But our understanding is if the vaccine is delivered at the time anticipated, that the first vaccines will be given tomorrow afternoon. That's Tuesday afternoon, to the hospital workers, and each hospital is responsible for the administration of the vaccine that they'll get in their possession. So as soon as that vaccine arrives at the Texas Tech Health Sciences Center, it will be stored in the Jerry Hodge School of Pharmacy freezer. They will then work through the logistics of getting it to the hospitals, and then the hospitals will begin the process of thawing it and getting it ready for distribution of vaccinations just as soon as possible. So just depending on the exact time that it arrives in the city, we'll start that time frame, but we would expect the first vaccinations to be given tomorrow afternoon.
Absolutely. And I guess the last question is, will data be added to either the COVID-19 dashboard or the report card about how many of the vaccine doses remain in the city and how many have been given to individuals in the community?
Good question, and not one that we have discussed making a change on the report card, but we'll put that into our conversation. Thanks for bringing it up.
I think that's it. Thank you, guys. I appreciate it.
Thanks, David.
Thank you, David. Let's now go to Judd Baker of Channel 4, KMR. Judd, how are you? Jed Baker of KAMR Channel 4. How are you today? Okay, we'll move on. I think we've got Vanya Patino of KFDA News Channel 10. How are you today?
I'm good, Dave. Thank you. And thank you both for taking the time to speak with us. The first question is essentially, who is going to be in charge of overseeing, how all of this is processed and administered and just kind of the details of it?
State is over the allocation of the vaccines. There are vaccines also coming through the federal government, and some of those will land in our city, like at the VA hospital. But as far as what we're relying on for our two private hospitals, BSA and Northwest Texas, we're relying on the state distributing vaccine for that, and the state is overseeing that process. As far as the actual vaccinations, the hospitals will be doing those for their staff. So they're going to take those 975 vaccines, they're going to split them basically equally between the two hospitals, and then each hospital will oversee the administration of the vaccines to their staff.
Okay, so each individual hospital has kind of their lead person on it. Got it. Thank you. And just to clarify, they will kind of be in charge of how that's transported out of the place where it's being stored into the hospitals.
The logistics for transporting the vaccine from the Jerry H. Hodge School of Pharmacy to BSA and to Northwest Texas Hospital are being handled by the hospitals and by the Texas Tech University Health Science Center.
Okay, thank you. I think that was all for us. And you mentioned the second dose, possibly the 975 coming at the end of the week. That was on the state website, but that's not a for sure number or for sure date, right?
Right. We are anticipating that the second dose would be another 975 vaccines. And what we're not sure of is the timing of when it will arrive in the city, but we expect it to be soon.
Okay, thank you very much. I appreciate you.
Thank you, Vanya. I'll try it again. Let's go to Jed Baker, KAMR Channel 4. How are you, Jed?
I'm good, thanks. Sorry about that a while ago. So my first question was, this might be down the line. I don't know if you guys have an answer to this yet, but when do you think maybe we could expect vaccinations for nursing homes?
Nursing home staff will be part of the vaccines allocated through the state of Texas, and they're ranked. If you looked at the vaccine allocation guiding principles that the state has put out, they're in the top part of that list. So that will just, as soon as our hospital workers are vaccinated, we just start working down through those guiding principles. They're going to be really toward the top of that. As far as nursing home residents, my understanding at this time is that the federal government will be sending vaccinations for the residents who live in nursing homes. Obviously, they're in a high-risk category, and we're concerned about getting them vaccinated as soon as possible.
Okay, and then my next question is, so Thursday the FDA is going to look over Moderna, and we'll see if that vaccination gets approved on Thursday. So if it does, is there a chance we could expect to see that here on Monday next week?
I think the idea is that it would roll out quickly. As far as having a specific time frame, other than just saying soon or as soon as possible, we don't have that time frame. That's not been given to us by the state, but it is logical to assume that they would move it just as soon as it had emergency use authorization from the FDA. They would move it out as quickly as possible. So again, this is a 4-day turnaround on the Pfizer vaccine. You might expect a similar turnaround on the Moderna vaccine as well if it was approved.
And do you anticipate the mask mandate ending anytime soon, even though we have the vaccine on its way?
I know we're all anticipating the day that the mask mandates are lifted. And I'm hoping that it's sooner rather than later, right? but no one wants it to be, certainly the doctors and medical staff working in the hospitals don't want it to be before it's safe for us. And actually that's going to come from the governor's office. But I would expect we're going to need for everyone who wants a vaccine to receive a vaccine, I think, before that mask mandate will be lifted. But that really is a question to be answered by the governor because it's his order. We're just simply, living under his leadership and waiting for the day when that will be lifted.
All right. Well, that's it for me. Thank you.
Thank you, Kaylee. That time, that's all the questions we have for our media members. I want to thank the mayor for taking time out today to provide this information to the community. Once again, we will do our regular Wednesday news conference, Wednesday at 11 for the latest in COVID-19 information for the community. We'll see everybody then. Thank you.